everybody. Welcome to Mental Health Matters. This is Tom Duff with St. Louis Counseling, licensed clinical social worker to the stars, and just all around happy guy, right? That's me. But this is Mental Health Matters, the podcast that helps break down stigma, brings the topic of mental health, emotional health, just us in general. Bring it to the table and to the forefront so we can make it okay to talk about when we're around the dinner table, when we're around the water cooler. So I am happy to be here. This is during these crazy COVID times. We've remained open. And if you are curious about St. Louis Counseling, check us out at stlouiscounseling.org. And so today, I'm going to bring on a great guest, somebody who I'm extremely excited to talk with. He's an old friend of mine, but also brings a lot to the table because he's somebody that I can have open dialogue with and open conversation around a lot of different topics. And one of those topics is race. And we've been able to share some good times over the years, but also at the same time, get in some in-depth conversation. So I thought it'd be a great topic today to get into is one, we look at some of the racial disparities with COVID-19, but also just walking into the world of social services and what that means. So I'm really happy to have on Jeff Campbell. And Jeff will be talking with me a little bit. Well, hopefully we'll stay on task. But Jeff Campbell, he's coming in. Trust me, he's going to be popping into the screen here any minute. There he is. Jeff, how are you?
Good morning, Tom. I'm doing well. How about yourself?
I am doing great. Great to see your face again, right? I'm framing it right there.
Absolutely, man. We haven't seen each other in a while, so it's great to see you too.
Yep. You know, I left Illinois and you kept going north in Illinois. Yeah. So how, as I said, I mean, hopefully we'll be able to stay on topic as we go here, but I'm sure we'll have some fun as we go too. But how's life in Illinois right now?
Well, you know, it's everything is kind of turned upside down, of course, with what we're experiencing with the COVID-19 pandemic, and you know, just the general stresses involved with the shelter in place. And on top of that, trying to keep everything intact, you know, not just with our careers, our jobs, but just in general with living with the family and everybody still at home. And so we're experiencing the general stresses that, you know, you pretty much can typically imagine during this time. But overall, Tom, you know, I'm really blessed that I'm still here. My immediate family has not been affected to a large degree by the pandemic. I do have some friends and other people that I know that have been affected by it, even to the degree of loss of life. So I'm just really blessed to be here. So any day that I can wake up and still have a smile on my face, still have a roof over my head, I'm doing well.
Well, you know, you're always smiling, so you bring that to the table. But you know, I always consider Jeff like a Renaissance man, right? So he is this out of box thinker, right? This individual who's kind of experienced a lot of different components in of life. But if I'm not mistaken, you hold a master's in public administration.
That's
right?
Correct.
Also, he's done so many different things in life. Also a minister as well too, and a huge, remarkable career in social services as well too. And even I venture to say, way back in the day, right? You kind of sold clothes, right? You even had a little shop
Oh
that you
yeah,
used to
you know,
sell.
yeah. So that comes legally. My father, he was an entrepreneur, so it just kind of naturally fell into place. And Tom teased me because I was a owner of a haberdashery. So you know, as far as the styles and being on top of clothing matters, yeah, I had a dabble in that. Yeah.
Yeah. So we've shared some fun stories over the years with a few different things like that. Um, so, you know, one of the things I wanted to kind of talk a little bit about today was, when we start looking at what, in the intro, I talked about, one of the things I value about our friendship is we've always been able to have open dialogue about stuff and be able to just ask questions. And I think that's one of the most important things in life is when you develop relationships with people, you're able to just kind of dive onto deeper levels and figure out different experiences that other people have had. And that's what's been one of the great things about you is, and we joke a lot too, we called ourselves, I
Absolutely.
think, Crockett and Tubbs,
Rocket and
Denzel,
Tub.
Ethan Hawke. We called ourselves a lot of different things.
Yeah.
And, uh, and I can just hear Rochelle right now listening to this and just laughing.
Oh, she would
Um,
love this.
she's going to get a load of it too. Yeah. But one one of the things is, we can have open dialogue about hard topics around race and stuff. And when I think about COVID-19, and when we see in the news, like, for a while here in St. Louis, all the deaths in St. Louis City to start with were all African American, and it was calling in the forefront some of the racial equities and inequities and disparity among healthcare and among other things. But I guess the question, right off, to you, like as an African American individual, right? When you're watching the news or you're listening to the radio, whatever, and you start hearing this, like this is coming to the forefront when they're just looking at death and how all of a sudden people of color are that's the majority of people who were dying originally. Like, how does that affect you right off the bat? You know?
Well, of course, when you hear of the disparities in, of course, the deaths that have been experienced as a result of the pandemic, it's disheartening as an African American man. But it's not surprising. And I say that for a number of reasons. Number one, because of just being an African American, you have a greater chance of experiencing a lot of the inequities that we see on a regular basis. Take, for instance, healthcare, the access to healthcare. That is a big inequity. Just adequate housing and the geographical area in which you live plays a major part. One of the things that alarmed me, Tom, is when we started to see these disparities, is that it was attributed to the lack of social distancing, and that actual I guess that lack of understanding even went around the African American community, and so a lot of the African American leaders were saying, hey, you need to stay at home, you need to do this, you need to do that, where in reality it had a lot to do with we were at a higher level of exposure to the COVID-19 virus in the first place. When you talk about levels of stress and trauma that is experienced in the inner cities, you have to take in consideration a lot of the physiological things that happens when a person experiences stress and trauma on a regular basis. You yourself know just by the nature of your profession, you know that people experience higher cortisol levels whenever they are exposed to traumatic experiences, similar to that which people that were veterans or served in wartime experiences with post-traumatic stress disorder. And when you see that, the African American community at large are exposed to high levels of trauma when it comes to living in a community where there's significant violence or gunfire, or that there's incidents where you're exposed to these things on a regular basis, then studies have shown that when you experience these things, you are at greater risk of health crises and health diseases. So I would attribute a lot of what we are seeing as a result of systemic issues that have been already prevalent in our community.
I mean, when you talk about systemic issues, right? Because you have a section of the population of our country, right? Probably the world that says, Well, if you live in those neighborhoods, then you need to get out of those neighborhoods so you can experience a better life, right? So when you hear that, right? Because I think that's where we start peeling back layers, right? Because people are like, okay, yeah, so that population suffered more death with COVID-19. Well, then they need to leave they need to leave that area and be exposed to a different environment. How easy is that? Isn't that a lot easier said than done?
It is a lot easier said than done. It is extremely difficult when in reality you have systems that are in place to prevent the very thing that we're talking about. You have, a lot of issues that have to be addressed before a culture, or in this case, African Americans or people of color, have the opportunity to even do that. One would be economics. Economics play a big part of, and the access to adequate housing play a major part in what we're talking about right here. So, to be able to pull yourself up by the bootstraps, you must first have bootstraps. And it's easier said when you're on the outside looking in, but when you're in, it's almost like you're trying to get out of this quagmire of things that's going on around you, and it becomes really hopeless to a large degree. Tom, I've been working in this field for over 25 years, and I've worked from one end of the state to the other. Had a lot of experience down in Southern Illinois, where you and I worked together. Uh, Moved to Central Illinois, and then up to Northern Illinois in the Chicago area, and I've seen a wide array of cultural differences, but poverty is the same. However, when you look at the disparities in poverty, you happen to see that there is a greater effect on African American people of color simply because of other issues that have not been addressed. The inequities that have been with us since our culture and our people have been brought to this country. So that is some things that we have to address first before we even talk about being able to pull ourselves up by our bootstraps.
When you talk about social services, yeah, it's funny. I started out in Northern Illinois and worked my way south, and now you're doing the opposite.
South,
It's
yeah.
almost like you're trying to get away from me, but that's okay.
Yeah, absolutely.
Um,
Absolutely.
but when we talk about disparity in social services, it's always we've worked in residential treatment, transitional living, community based, and it's always interesting to see client base, and
Hmm.
even in Southern Illinois, I know for a while DCFS was um, focused on the disappropriate number of African American kids in care in the state or in the southern region of Illinois. And it's like I would venture to say that's the same across the state when you talk about kids and at risk. Even though the population of African Americans, Caucasian is much higher population in Illinois than that. I mean, would you say that too from your travels going up and down the state? It's kind of the same vibe.
Yeah, it's definitely that same vibe. When you look at, I think in 2019, the total number of youth in care in the state of Illinois was somewhere around 15,000 kids. A high proportion of those individuals were people of color or children of color. And so you still experience that, and it tends to you know for you to ask the question, why are those disparities being experienced? Is it that there you have to ask these questions. Is it not that there are other races that experience needing to be placed in care or have those services, or is it just that there are disparities in placement options, or just the overall effort to have these people placed in foster care or even in adoption situations? In where I work at now, Tom, the agency that I work at now, I would dare to say that 99% of the clients are African American. And we see that the failed placements are really high, on an average of about 5 to 6 failed placements when we even start the service with these young people. So, when it comes to them feeling like that there's hope or that someone cares for them, that's really something that's really intangible for them. You really don't think that there's anyone that can help them, and so we have to peel off the layers of the onion, and that take months before they even feel like that we are able to help them or that they trust us enough to help them. So yes, I've experienced that from one end of the state to the other, and it seems that it's the same song, it's the same dance, and it's something that's really disheartening when you realize that the overall population of the United States is a small population. I think that African Americans make up about 30% of the population, the total population of the United States. And so, we have to start looking at these issues. We have to start looking at the disparities. We have to start looking at why that there's so many failed placements. We have to look at the traumatic experiences that we're experiencing and possibly even a large degree causing the failed placements when you don't have people that are the caregivers even knowledgeable about trauma or the effects of trauma or how to provide the service necessary or the care necessary to make these placements even successful.
And and then you even talk about like this generational, so even with like you mentioned like the kids of today, right, that trying to work with, trying to help change, and then they have these failed placements that occur, 5 to 6, as you were saying, and then this level of distrust continues to build in an individual because, and which all equals back to trauma as well too, of course. um, but this level of distrust that continues, and then you grow up with this, and that's where I think people that don't work in the field, or that don't allow themselves to listen to conversation like this, they just don't get like that level of distrust that occurs because of the experiences that one has endured. Like I remember we had a conversation a while back. I think, I was talking about like when I was growing up, like I wanted to be a cop, and like I was watching Chips, and all that. And sure, I wanted some of those cool boots and uniforms like those guys wore, but I wanted to be a cop, and you're like, well, I grew up thinking cops weren't that great, but it's like two different worlds, you grow up in, and it's shaped, because of experiences that we've had in that sense. And so I think that's important too for people that, that are hopefully listening right now, but they understand, this level of, so when you talk about this population of 30% across the United States, African American, and the things that have shaped them, and why individuals have a viewpoint that they may have, it's because of the experiences that have shaped somebody.
Absolutely. We come to the table with a unique set of experiences, viewpoints, just mainly from, our walking in our shoes. I have to oftentimes, try to pull myself out of those mindsets so that I can be more objective when I am providing services. I have to be able to understand someone else's perspective on how they look at and understand that ignorance, and I'm not saying that in a demeaning manner, but the ignorance of understanding what someone experienced is definitely going to frame your behavior. So I oftentimes, as an African American man, feel that I have to be more understanding of being in this field because I have to look at the perspective of both sides. And sometimes that's tiring, Tom. It really wears you out, especially when you're trying to provide a service, and you feel like you're getting pulled on both ends. You feel like you're getting resistance on both ends. And you want people to understand that, but it all actually culminates in us being able to sit down and have dialogue and be able to, I guess, be open to understanding another person's point of view. I often hear people say, well, I understand what you're going through, but you really don't understand as being someone who is not African American, the things that people have to go through being African American. On just myself as being a person who I consider professional, I still have to be mindful of when I go out into the community, how I respond, how I reply back to a police officer when I'm pulled over, or when I go in a store, and just the general conversations that you have with people, and it's the things that people say that it's not. They don't have the mindset of understanding of what they just said actually uh, has triggered something. In you, in your mind, you're thinking like, wow, this guy really does, he don't get what he just said. And you have to go back and replay that and try to say, well, he didn't mean what he said. I know I just didn't hear what I said. These are things that African Americans go through on a regular basis, and for specific segments of the African American population, women go through a lot, men go through a lot. I'm not going to say that I understand what a woman goes through, but from what I understand, that there's a lot of things that an African American woman has to go through as well. I've seen it, but as far as experiencing it, of course, we can't understand that. So.
Well, and hopping back to something you said, about that, like experiences, we all experience, we're shaped based on our experiences and what's happened to us. And then when you have to bring yourself out of that to be objective, right? That's a process in the mind. And then for you, like you said, at times it feels like you have to do even more because, you're working in this professional world and you're trying to look at both sides, and having that struggle of day in and day out, the toll that takes, then that extra toll that takes on your emotional health, your mental health, because we're a big proponent here at Mental Health Matters about, we all have mental health, right? We all have just like physical health. But when you talk about then that constant struggle, it's like the mental health of racism, right? And the systematic issues that are there. It for you as an individual, it's wearing on you, and I'm trying to phrase it back the way you phrase it to help people understand. There's even more of an emotional pull on you because you're walking outside to be objective. Because for everybody, right, when we have to be objective and put ourselves in the shoes of somebody else, that's always a process. There's a toll there, but it's this mind power that you have to keep, and it's a drain, I would imagine, especially when you hear offhanded comments, and it's like, did he really say that to me? And
Yeah.
and I mean, talk a little, maybe try to describe kind of maybe that emotional toll that can have on a person.
For myself, it's a mix of emotions. It's sometimes it's even to a level of despair because of the fact that you feel like, man, what is the use? How is this going to change? We've had a lot of people that have brought these points out, and it still seems that people are not willing to try to understand. When you have power and you don't want to relinquish that power, then you are not going to be readily accepting to understand another person's point of view because you now have to acknowledge the injustices. You have to acknowledge the disparities. You have to it now becomes a call to action. And for me, it's mixed with despair, sometimes anger. Sometimes you want to give in, but everything in you tells you that it's a greater horizon, that there's a purpose in life, and that this is just something that you have to do in order to maintain. You have to do this in order for posterity. You have to do this in order for the preservation of not just yourself but your family and your culture. And it's not it's humankind, Tom. It's not just culture. It's humankind. So it takes a toll on you, but you have to learn how to self care, to have self care, which comes to for me spirituality. A lot of it has comes to me talking to people. Say for instance yourself. Again, you brought up the point that we have the platform to talk openly with each other, and you know our relationship and our friendship has been based on us being real and true and open. You know, and I remember you called me one time about an instance where you had a situation, and we were able to just kind of deduce it and talk through it. And those are the types of things that we really need. And oftentimes it doesn't come with the answer. Time it's just being somebody there, being able to listen and for you to vent. Those are the things that I deal with. I have to every day have to put myself in a perspective and a mindset that I'm not going to allow yesterday to taint my actions for today. And I'm assuming that everybody has to do that. I'm not saying it's just me, but as for me, I have to make that a conscious effort. It's a conscious effort on a daily basis. And so, in other words, Tom, I'm gonna tell you something that I noticed. I noticed that I live in an area of town that there's a mix of people, but it's predominantly Caucasian or white people. And I see people out and they're walking, man. They're just walking, and they're just it's basically like it's carefree living. And I know that people have issues, and people have situations, and people have experiences, and people have problems of their own. But to a large degree, I can't see that in the African American community. I can't see people just out walking and walking a dog, or just walking and have a conversation. And so you see the differences um, of the life experiences. And so as I was looking at that, I'm like, wow, I wonder what that's like to just uh, it seems to me walk through life and not have the challenges that if you see a police car, or if you run into somebody of the opposite color, that you have to be on guard with what you say, or how the little nuances that take place in those meetings.
Yeah, it's as you were talking, I was this was a little while back. I was with a group of people, and somebody was trying to take a drink outside of the restaurant, right? Which it was a place where you shouldn't be doing that. And there was cops out there, right? And the one person was like, "Man, I feel so guilty." He was a white guy, and he was kind of hiding his drink, and he was trying to. He goes, "I feel like they're watching. Are they going to come over here?" And we were with one of the other guys, was a black guy. He goes, "That's how I feel all the time." He goes, and it's like it made a lot of sense for a couple of other guys I was with, and they're like, "All the time you feel like that?" And then he's like, "Yeah, I feel like that all the time. That I'm that just my that's what shaped me, you know." So it's like the guy holding the drink, that's just the only time he felt like that, because he was holding the drink. He knew he was doing something wrong. But the black guy was like, "Well, that's how I feel like all the time, because of things that I know could potentially happen to me because of just the way I look." He goes, "So I'm basically the drink that I'm just walking around all the time." And I was like, that's an interesting way of looking at that in that standpoint. But one of the things you
And
said.
Tom, I was going to say, it's oftentimes when, I apologize for jumping in, but there's times when you escape that for a moment, and you find yourself like, wow, I'm not thinking about that. You know, I'm not thinking about race. I'm not thinking about you know uh, the interactions that I'm having, and that right there, man, that moment right there is just like, it's a beautiful thing. But it oftentimes puts you in a hypervigilance of, oh, something is about to happen. This is not going to last all day. But yeah, I get it. It's something that, again, going back to our original talking point where we were talking about, the COVID-19 and the ravages to the African American community. When you talk about this, living with this on a regular basis, you automatically put yourself at risk for exposure. That with those higher levels of cortisol, from my understanding of that hormone, it's the fight or flight hormone, and it causes other things to shut down, and it causes the immune system to shut down. So when you talk about people like this, you see high levels of diabetes, you see higher level of hypertension, you see higher levels of high blood pressure, you see higher levels of mental health. It's even to the degree where, when you look at younger kids, anxiety and the inability to concentrate. So, it's no wonder that we see kids having problems in school, and then now you got the issue of the prison to pipeline, the school to prison pipeline, because of the behaviors that are experienced in the school system. So, these are a lot of things that, it comes down to, um, when we break it down, it comes down to, geographical area in which you live, the disparities in education and economics. It comes down to, even to a large degree, racism and oppression. It comes down to a lot of those things. And, Tom, I don't want to give the listener or the viewer, just paint this broad picture of, hopelessness and everything, because there are some thriving African American communities, and there's some thriving African American people, and I consider myself one of them. I consider myself blessed to have had the experiences that I've had, even in spite of the challenges that I've had in my life. If I, and I've shared with you about challenges that I've had in my life, but I was able to, because of the supports that I had around me, able to transcend that. And I remember a while back, Tom, when we worked together, you presented us with the 40 developmental assets. I don't know if
Mm.
you remember that. And I was doing some research on that, and it just so happened that having the supports necessary around you is key to helping people to get out of and to transcend a lot of those traumatic and stressful situations. And it just so happened that everybody don't have the supports. They don't have the uncles. They don't have the cousins. You have kids out here that seem like they just dropped out of the sky. They don't have those individuals necessary to help them to navigate through the things that we see. Even as a grown man, I have to navigate through life situations, but I have the access to some of those key supports to help me. Being able to talk about it is very vital, and being able to trust someone is very vital. And oftentimes with people that don't have that, they're left to their own demise, and it a lot of times it ends tragically, either being in prison, either being homeless, dead, or just in mental health institutions. And so, we have a lot of work to do, but it starts with realizing the issue, and it starts with being real with the issue, and it starts with not feeling like taking on the blame of that, but putting the boots to the ground and saying, hey, these are the issues, we need to address these issues, and not covering it over and putting our head in the sand as though it's not happening.
Mhm. Yeah, exactly. And that's one of the huge reasons I wanted to have you on today was I mean, you're kind of summing it up there perfectly, and I do think it's about relationships. And, when we talk about, you described what it's like to be a grown man, educated, Renaissance man, as I called you, right? And there's still a toll on you in that sense. And we know our kids of tomorrow, our kids of today that are turning into our grown-ups tomorrow, they're feeling that. They're feeling the same things you do. So those tips you were giving is, I hear a lot of things about, you know, surrounding individuals, whether it be a kid or an adult, but surrounding individuals with with assets, with relationships, with supporting individuals and supporting mechanisms that can support them into another level of success, whether that be reaching out purposely or finding somebody that that knows someone else that could use the support. But I think that's an initial step. But really, like you said, it comes back down to just starting conversation and realizing what exists, right? So when you talk about hopeless or not, we'll talk about hopeful. Maybe we'll kind of conclude here on from your perspective when we're talking about some of the path we could take, and what are you hopeful for? Let me ask you this question. Maybe you might have to put the minister hat on. I don't know. But when you look at our next generation, right? What are you hopeful for, and what do you see the potential for in the individuals?
Tom, I'm hopeful because I do see people who get it. I do see people that they're altruistic in their purpose in life, to the degree where even you yourself bringing me on to have this conversation, is a start. So I'm hopeful that we can get past the hurt, we can get past the distrust, and I see that in segments, and there is a remnant of people that are putting the effort in to make this happen. And Dr. King said, a man who has not found anything to die for is not fit to live. And it's a lot of people who are willing and have put their whole lives and careers on the line to see that we as a human race survive. And I'm hopeful, and I see that. And those are the things, Tom, that really give me hope. Those are the things that cause me to get back up again the next day and go at it. And those are the things, man, that make you realize that what you're doing is not a mistake. I've tried to get out of this field for many times, Tom, and it ends up, I keep coming back to it. It keeps sucking me back in because it's what I do. I get fed by helping people. I get fed by interacting with people. So, being able to social distance or having the social distance is not working well for me. Although I'm not going to be foolish to go out and just mingle with people without having my proper precautions, taking proper precautions, mask and everything. But, for a person like me who likes to engage with people, who really thrives on helping people and look for that silver lining, it's been trying, but I'm seeing it, and that's what's keeping me going.
Awesome. Well, we've been here today with Mental Health Matters with Jeff Campbell, old friend, Renaissance man. I was just thinking, as you were saying about the mask, wearing the mask, you might be able to get back in the business, the clothing business, with Jeff Campbell line of masks. What do you think?
Oh yeah. Hey, don't think I haven't thought about it, Tom. I might have a line, man, already in existence, man. I'm gonna send you something here in the next couple of days.
Awesome.
You can promote my line, man.
I'll take care of that. You know what? You could be a sponsor of the podcast then. It'll be beautiful.
Absolutely.
All right, everybody. Thanks for tuning in today. Jeff, thank you for coming on and taking the time with us. Appreciative as always.
It's been an honor.
All right. Until next time, this is Tom Duff with Mental Health Matters. See y'all later.
This has been Mental Health Matters with Tom Duff of St. Louis Counseling Services. Check out stlouiscounseling.org for more information.